What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering different things doctors have asked me to do on the portable machine for them. So to give you context, I'm a night shift Xray tech. Been doing it for over 4 years now at a Trauma 3 ER overnight. So essentially, some of the more common requests from your doctor, and once again, it all comes down to who the doctor is, what they're trying to look at, and if your shitty machine can kind of do the thing they're asking, because certain machines you can't do it, or it's not easy to get to it, like to find it. For instance, I'll give you an example. We have a GE portable machine and we have a Fuji portable machine. On the GE, you can measure and take measurements of stuff. On the Fuji, to this day, we can't find wherever that little measuring device is, and we always got to tell them we don't know. Some of the more common requests is, can you invert the image? Essentially, you turn it inside out and it looks, the opposite. Other times they'll ask you to try to zoom it in for them. Once again, little magnifying glass, you zoom it in. Sometimes they ask you to adjust like the contrast and stuff like that. Once again, that's not that hard. Other times they ask you to, what's it called? I'm trying to think, because there's like, you can, it's almost like a filter or some kind of adjustment on the machine where essentially it becomes like more grainy, or it's like the details change from like it's more like it's a different type of contrast. Not like contrast, but it's like all the lines and all the actual tissue becomes like more, how do I say, it's like some kind of filter, and essentially it becomes more detailed. Like you can see things a little bit more better, but other stuff gets like kind of like, you can see better lines, I would say. Like the central lines and all that, you can tell like where the lines are, and all the tissue and stuff maybe not as much. So it's a different filter. Usually we never send them like that. So once again, if they ask you to invert it or to do whatever, once the doctor's done, you kind of revert the image back to how originally it was for our radiologist. I mean, there's times where the doctor will ask you to shoot a chest for like an NG tube, and then you look at it and it's not there, and they'll be like, yo, can you go a little bit lower? Can you shoot a KUB? Can you do this or that? And sometimes the tip will be there on the chest, but since you shot it under a chest technique instead of the KUB, it won't be as like, it will be hard to tell. So sometimes you're able to throw a filter, like use the KUB filter, thing, and it'll adjust the readout number and the image will change the way it looks like, and you won't have to shoot another one. Other times you will have to shoot for the KUB for the NG tube or whatever. You have to adjust accordingly. Sometimes, depending on how the light hits the portable, it's hard to look at the image because there's glare. There's been times where me and the other tech are trying to like cover the light for the doctor so he can see, or sometimes I'll grab the LED and like kind of like put a little shadow over so the doctor can look at. To this day on our machines, you can't adjust the brightness. If we could just adjust the brightness to be like super bright, that wouldn't be a problem. But essentially we talked to one of the technicians who works on our machines, and essentially said if we had it on max brightness, our shitty equipment couldn't handle, as far as like the battery would die really quick. So essentially they're on like low power, like low contrast, low like brightness, so the battery lasts super long and stuff like that, which it gets kind of annoying. But that's something that you commonly see at our job. I think it's kind of universal, especially like in the trauma room where there's a bunch of lights. It can cause problems. Sometimes you have to turn off the lights. There's been times where, like, instead of reshooting the image, you can just duplicate the image. Sometimes they'll ask you just to duplicate it and just crop it, and you can send both instead of, you know, having to re-expose the patient. Sometimes they'll ask us to do that. Sometimes they'll ask us to, trying to think here, quick start. So essentially you get a verbal order, and so you can put that online because they don't have time to order it yet. So that's something, I mean, there's a little button or trauma, quick start. You can do it there. Trying to think what else. Certain equipment I've noticed, and it's mainly like the newer one, it'll give you like a little assessment where it can tell you if there's like a pneumo or you have to readjust, or it can kind of read like how deep the like if a patient gets intubated or the central line or whatever. They have a little button on the newer machines. I've seen it. Some doctors have asked about that, and I'm like, well, our shitty equipment isn't new enough, so we don't have that. To give you context, my Fuji machine has been running on Windows 96 for this past 3 years. Until recently, it got updated to Windows 10. So that's some context for you as far as where you can work at and how shitty equipment you can have. Like, our main has computers that are super old. Their systems uses NVIDIA from like, not the new NVIDIA that's out now with doing AI, like the 96 version of like old, way back in the day, like NVIDIA, old graphics thing. So depending on where you work at, I'm telling you, you'll use different equipment, and not all of them are the same. And with some equipment, you may have to make more adjustments or less adjustments, depending. Like, there's certain machines I've used where the image is more burnt out for the same technique, and you have to adjust accordingly. So depending on what they're trying to see, the doctors wise. But yeah, that's all I got for you. If you enjoyed today's video, you can check out my channel. I post daily videos on this beautiful world of radiology, because when I was a student, nobody would be posting aspects of this, and I was always curious about it. There'd be like older videos that had nothing to do with some of these. So I'm just giving back to the community and letting y'all know. And if you're still debating between, oh Miguel, I don't know if I should be a nurse or I should push the button. Just saying, my lady's a nurse. She's not always happy. So that's something. I ain't trying to persuade you to do nothing. It's just, you know. I myself almost became a nurse until I realized there was Xray. So, you know, not always people know that the nurses, that there's other careers out there in the healthcare field. So, as always, I'll see you on the next one.